I have a lot of flashcards, all of which I designed to help me pass my paramedic exam. And now each episode I take 10 of these to share with you in hopes that you might do the same. My name is Zach and this is Paramedic Zach. Alrighty, so thanks again for joining. We are now on question 131, so let's kick it off with tea-colored urine. During heat stroke, tea-colored urine is indicative of what condition? So a hyperthermic episode leading to heat stroke can cause a condition known as rhabdomyolysis. Rhabdomyolysis is the breakdown of a specific protein in the body known as myoglobin. Myoglobin is a red pigmented protein that, when excreted, can make the urine appear tea-colored. Moving on to question 132. In patients with symptoms of a CVA, i.e. a stroke, fibrinolytics need to be administered within blank hours of the symptoms onset. So fibrinolytics are your clot busters. They're known for their ability to dissolve intravascular clots, and they're beautifully used for the treatment of ischemic stroke, i.e. a stroke caused by a clot in the brain. In order for them to be effective, the fibrinolytics need to be administered within 3 hours of the symptoms onset. Generally, this number doesn't vary much, but I have read that some agencies employ a 4.5 hour rule. Moving on to question 133. To treat calcium channel blocker overdose that is refractory to glucagon, use calcium gluconate at a dose of blank to blank grams over blank minutes. Hint, it's not 10 minutes. So your first line treatment for a calcium channel blocker overdose is going to be using glucagon. Glucagon can be used intramuscularly at a dose of 2 milligrams, but if that is refractory or does not work in treating the calcium channel blocker overdose, you can try using calcium gluconate. This is typically used at a dose of 1 to 2 grams over a period of 5 minutes. Moving on to question 134. Primary adrenal insufficiency is also known as blank. So primary adrenal insufficiency, i.e. where your adrenal glands do not produce enough of their hormones, is also known as Addison's disease. Moving on to question 135. A normal blood pH is between blank to blank. So a normal blood pH is just the tiniest bit alkaline, coming in at 7.35 to 7.45 on a scale of 0 to 14. Moving on to question 136. When using Rocuronium as your paralytic during rapid sequence intubation, what is your dose? So some agencies have a ranged dose for the Rocuronium administration, but a typical dose that you'll see is 1 milligram per kilogram IV. Moving on to question 137. A normal respiratory rate for an adult, child, and infant are... So obviously this is going to depend a lot on circumstance and the patient's past medical history, but a typical respiratory rate for an adult at rest is 12 to 20 breaths per minute. For a child is 15 to 30 breaths per minute, and for an infant is 25 to 50 breaths per minute. Question 138. During a pediatric pulseless vtach or vfib arrest, if amiodarone is not available, give blank at a dose of blank milligrams per kilogram. So our backup to amiodarone when treating a pediatric patient in pulseless vtach or vfib is going to be lidocaine at a dose of 1 milligram per kilogram. Question 139. Name 4 scenarios where end-tidal CO2 should be implemented. So of course there are way more than 4 scenarios where you might want to use end-tidal CO2, but the 4 top ones that you might consider are respiratory distress, sepsis, cardiac arrest, and suspected acidosis. And lastly, we have question 140. What is your pediatric atropine dose when given via an endotracheal tube for bradycardia? So if your intubated pediatric patient is now hemodynamically unstable due to bradycardia and you no longer have patent IV access, you can administer atropine via an endotracheal tube. In order to administer any medication via an endotracheal tube, the dose needs to be 2 to 2.5 times higher than that you'd give via an IV. As you may know already, a typical atropine dose for a pediatric patient that is bradycardic is going to be 0.01 milligrams per kilogram and then increasing to 0.02 milligrams per kilogram if needed. A endotracheal tube medication dose, however, needs to be 2 to 2.5 times higher than that you'd give via an IV. Therefore, the dose via an endotracheal tube is going to be 0.05 milligrams per kilogram of atropine mixed into a 5 ml bolus of normal saline. And that wraps it up for this episode, guys. If this is helping you in any way, please do me a favor and hit the like button. It helps with the whole YouTube algorithm thing. And if you want to get these videos regularly to help you pass your exam, make sure you subscribe. Thank you guys for joining and take care.